Good afternoon and welcome to everyone. You're listening to Preparing Your Documents for the Electronic Medical Record. Our guest today is Brad King, Senior Systems Consultant. Brad and I have worked together for over 20 years. His knowledge of healthcare and software has been taught across the world, from Guam to London. Brad is going to explain the final steps towards implementation of the electronic record today. His topic is integration of the EMR across the enterprise. First of all, let's begin by talking about who is Formfast. Well, more than 1 out of every 5 hospitals in North America who choose to eliminate paper choose Formfast. And they choose Formfast to lead them through the EMR process, both through software and consulting. That's an amazing figure, considering that 15% of all hospitals in the United States and in America today have only chosen to eliminate paper today. Formfast is a company that helps you with printing processes. Formfast is a company who can help you with workflow applications that need rules, roles, and control by your organization. Any applications surrounding the paper process can be greatly improved while running a document to the electronic cold feed in your system. Any eForm can be filled in on the screen. Any workflow process can be worked with. If you need to fill it in on the screen, we're the people that you need to talk to. Because of our dominance in the marketplace, our financial stability is great for you. Our partners, we've got many of them, as you can see at the bottom of the screen. All these partners in form fill and printing, all these things make us the right choice for the EMR. Our guest today is Brad King, and Brad and I, as I said, have worked many, many years together, but I consider Brad to be one of the best in the business. I want to say good afternoon and welcome. Brad, you have the ball.
Thanks for the big lead in, Ed. I hope I can live up to a portion of that. What we're going to talk about today is our third in this series that we've done, and it is basically creating the electronic medical record and completing the steps, the process. What we're going to talk about are determining the requirements, and these requirements would be over and above the things you may have already seen in earlier presentations. What we're going to do today is look at how to take this into a paperless or very little paper environment. And the first would be a statement of the way we see this, and basically that is a clear vision of the desired results equals a successful project. So we do things a little bit backwards, and we're going to explain that as we go through this. The first step that we have here would be evaluating the current process, and there's a lot involved with evaluating the current process, as well as an implementation approach, and we're going to cover a couple of those. We're going to cover a tiered implementation approach, which is basically where it would be rolled out a little at a time, and then the one-shot process, which we're going to cover as well in detail, and that would be where we flip a switch and everybody goes live all at one time. We understand that all this is going to be an evolving process, and we're going to touch on that, as well as we're going to touch on process management, and that'll cover what's to come after the implementation of this. The first thing we're going to look at is determining the requirements. And once again, as I spoke earlier, we're going to look at the desired the final results, the desired final result, and we're going to work backwards from there to accomplish that. Within that, that's going to consist of output management, consisting of document preparation. And your document preparation can be quite extensive based on the number of documents that we're doing. It would consist of paper to electronic conversion, and then we're going to look at repository management. We're going to look at retention control, document automation, the output mechanism for document automation, and the output mechanism we're going to get into, and that would be on the output end of this. The document workflow process, and we're going to show you how you can streamline document movement. And we're also going to look at staff acceptance within this and making this as seamless as possible for the people there. We're going to now look at determining the requirements, whether you need consultative assistance or not. And these are things that Formfast can help with as well. Formfast is a leader in preparing clinical documents. We've done that for more people than anybody. We're the leader in that. And that would be converting your documents from paper to electronic, whether they still end up on paper or not. We also offer consultative services, and we're going to get into that a little bit. It would review and document the current process and compare it to an automated system, and also lay out how the automated system would work with that. We're going to determine document categories and see if documents can be eliminated, whether they can be reformatted, or whether enhancements can be made to them to make them work better. We're going to look at the detailed end results of a detailed project plan, and this is what you would create to actually have all this happen. The first function of creating that detail would consist of security features. We would enlist IT's help to come up with how we're going to handle security as far as the data security, because now we're not talking about just blank forms. We're talking about patient data on the forms and actually clinical data on the forms. That would also cover a budget and timeline, prioritizing details and creating a timeline that would set up basically steps for this and when those steps would be completed by, and also the hardware and human resource requirements and cost. And when we say that, what we're really referring to is the cost of additional equipment if necessary, and also the cost of people if you had to add people to do this. It may or may not be necessary, but the project plan would also outline that. We would then look at prioritizing the requirements, create a high-level project plan, the overall project objective, and once again, the objective would relate back to what we referred to earlier, where we would look at what we expected the output of the product to be, and then worked back from there. The anticipated timeline and the major components of that. So this would refine all of these things as well. Nextly, what we're going to look at is the required details. The leadership resource assignment it would consist of the project sponsor, and that would be somebody in upper management that was a supporter of this project, a person on the management team of this project with authority and credibility and the ability to make decisions and actually make decisions for purchases and make decisions within the workflows and the things that are developed as well. The implementation team, and that would be the people that actually did the work, and the term I always like to use for that is that would be the Indians. We've got a bunch of chiefs above them, but basically the implementation team would consist of the Indians that did the work. Next, we would list the steps to achieve this and determine a starting point. And I know it sounds crazy, but typically it's decided by the desired end result. So we're going to look at what we want the end result to be and then figure out how we can get to that point. Break progression into milestone phases. We would do that so that we knew where we were and could put deadlines on things and could assure that things continued to move forward, and also give us the end result and state the end result that we're looking for. So I know that one in three of that seemed a lot alike, but then they are. Determine and document the current process. And the current process what we would do there is document that, or what would need to be done there is to document the actual process, and we're going to get into that in a little bit more detail also. The pre-evaluation process. We would document the existing available hardware and software, create the ideal project team list, hopefully it would be the ideal, gather and process the information steps, and this is where we were going earlier, obtain existing process flowcharts, obtain existing policies and procedures, all revolving around the process that we're talking about replacing, so that we can then know how things should be, and utilize. You could possibly utilize outside document consulting services to do the things at the bottom, basically to free up your internal resources and develop a detailed plan, and also get a third party involved that's more objective, so you would get an objective opinion about it. What we typically find is that the workflow is supposed to flow one way, and we find that it may or may not be going that particular way. So with this, you would have a third party. With utilizing a third party, you would have that opinion as well. The outcomes that we expect to get from that would be to document the actual current process, and the actual current process may not be what is documented, and that's what the next thing states, is that we would compare the actual current process to the documented current process and highlight deviations and provide reasons behind the deviations, because there may be very good reasons why they don't do it the way that the documentation says they should. And so some of those things may lead into this and actually be taken forward with this. And it would allow the project team to evaluate impact, and that would be potential delays, basically impact points throughout the project, so that we could set the project up so that if certain things weren't done by a certain day, we would see it delaying the overall process of this. We would identify existing auto ID technologies, things that are in place today that are working for you. So that would be things like OCR, barcode readers and symbologies, and other systems that you may have in place. Some of the more automated systems within the healthcare industry seem to be phlebotomy in the lab, maybe pharmacy, and those areas can be incorporated into this so that they're a part of the workflow.
Hey, Brad, I got a question for you. Before we get into implementation work plan, in your experience, when a hospital uses consulting services, what's the biggest difference between when they try and do it themselves and using a consultative service?
Well, the consultative service brings with them a different viewpoint. They only know what they've used in the past, and the consultant would bring in tools that they've used and seen used at other locations. So you get information from more facilities than just your own, and you get
and you got another set of eyes to it. Yeah, that's what you're saying, is you have someone else looking at it. Okay.
Right, and they may be more objective. You may be narrowly focused on the one thing, and they may be able to better look at the big picture.
Okay, tell us about the work plan.
The work plan utilizes WBS, the work breakdown structure format for control. It creates a project charter consisting of the project goal, and once again, the project goal will be truly the outcome. So that's where we would get that. It breaks the objectives into task and subtask, and determines the critical path that would result in the task that could delay the result of the project. So it would create a critical path, and things would be marked as critical, so that you knew if those weren't met, that there would be delays involved from that point forward. It would assign resources and time frames to the task, and create target and celebrating. It would create targets, and you could celebrate milestones because of the targets that you knew you were achieving. What we're going to look at now is the implementation strategy. Project management would use the project charter and scope statement, a detailed work plan with milestones, executive communication to maintain the sponsorship, and that would be the upper level sponsor within the project. What we're going to look at too is a couple of the work plan approaches. Once again, we told you that we're going to talk about two, and I'm going to give you some details on two. And they would be the potential one-stop work plan and the advantages of it. The real advantage to it is that you get a faster ROI. The negatives to it is that it's like flipping a light switch, or the Big Bang Theory. Everything happens at once, and you turn it all on at once. We've actually had customers that have done both of these procedures, and both have worked for people. It's just a matter of your level of commitment and level of, nerve to do this. Also, we're going to look at the potential work plan, which is a phased approach. With it, it's a slower rollout and a slower return on investment, but you get more testing, real testing, because you would roll it out in phases. With this approach, what happens normally with the Formfast products is a phased approach is rolled out, and it would be rolled into one area, and that area then champions it throughout the facility so that everybody is screaming for it, but before it's actually implemented. So we've had good luck with both.
Polling question number 3, folks. 15 seconds of your time. It's all I need. Go ahead, Brad.
Okay. And our next slide is a plan. And once again, we're going to look at those in a little bit more detail. The first phase, and this would be for basically both plans have a lot of the same steps. The difference is just with the actual implementation of it. So we're going to look at all these steps, and this is the phased approach. But what you're going to find is that we're going to have these same steps with the other. So with the phased approach, we're going to have document automation that's going to consist of a form inventory conversion, and that's probably going to be one of the bigger steps, believe it or not, to all of this, because that's going to consist of converting your paper-based documents to electronic and actually finding what documents you have. Secondly, we're going to look at the electronic document plan, the chart assembly, and this would be things that are affected electronically by it, and that would be things like cold feed, secondary entries such as signatures, and things and data that's added to the form after the form is initially created. And then lastly, what we're talking about there are excluded documents. And excluded documents are documents that aren't able to be put into an electronic system. There will always be some documents that can't be automated electronically. So there will be excluded documents, and there'll be documentation associated with that as to why those couldn't be done. So that's what we're talking about there. Advancing the technology, there'll be a hardware inventory and layout, and ordering or delivery targets for any necessary additional hardware, and installation and device availability of new hardware if it was necessary. Nextly, we're going to just continue on with that at Phase 2, and this would be moving further into it with an electronic process model, and it gets quite involved with healthcare because of all the regulations, and that's what we're referring to here. And that would be a review of what we've come up with as far as whether it met your federal and state regulations, whether it met Joint Commission's requirements. For electronic record and retention periods, as well as access points and methods of access. So whether we met the requirements that were necessary to control that. Also, the chart component disposition, and that would be, how it ends up, what we do with it at the end, and how that's handled as well. And special considerations, and there will always be special considerations. Whether records get closed, whether they get flattened at the end, what happens to them at the end, or during the process, how they're handled as far as all the process of the workflow.
Brad, what is a flattened record?
What a flattened record is a record that's uneditable. It would be a final disposition of a record, and it would be once the workflow has been completed and everybody has approved the workflow and the record is basically closed, and we call that flattened. We would also look in, I skipped that one, at the impact on the health information management staff, because it will affect them now, because now things will be electronic versus paper. Number 3, we're going to look at the rollout, and this is the biggest difference between the phased plan and the one-step plan. And we're going to go through both, but we're not going to talk about the last 2 slides in the one-step process, because basically those are the same. With the enterprise rollout preparation, report component status, we would have training milestones, and we would still have these things even with the other. There would be quality assurance strategies, competency checks, quality indicators, basically a Q&A. And it would be a Q&A strategy to verify that everything we had done was the way that it needed to be. And basically, the Q&A would not need to be as strong here, because what we're going to do is pilot this to test it. So this is the pilot approach, the phased approach. And then after the pilot is there, we would be able to learn lessons from that and verify that we were meeting everybody's expectations. And that would be upper management, the IT and HIM teams and staff, and more and most importantly, the users, because overall, the users are probably going to be the most important with the pilot and with the product. If the users don't like it, we're going to be in a mess. And now we're going to move on to the one-stop work plan. And basically, you have to do all the same steps. The difference is that step 3, and that would be the rollout. It would require extensive testing on the front end. It would basically every I would have to be dotted and every T would have to be crossed, and the process of that would have to be extensive for the one-step plan. And with the one-step plan, all that would have to be done. You'd have exact dates to select to go online, and the staff would have to be pre-trained and ready for that particular day. The planning and coordination is paramount when it comes to this method, so that everybody is ready for it when it comes. The outcome and the benefit of this is it reduces the dual system impact period, meaning you don't have to have paper and electronic all at one time. You can basically discard the paper that day and move forward from there without ever looking back. The changes must be handled immediately, and what we mean by that is that when you decided to go live and do this, you would want to make sure that you had staff available for any changes that had to be made when they went up, and hopefully that would be minimized by the high volume testing. But if it needed, you would want to make sure staff was available for that when you implemented in this fashion. And one of the other negatives, and it may be a negative, it may be a positive, is it may be difficult for the staff, but it also could be easier for the staff. So if our approach really simplifies the staff's work, then it might be an easy thing for them. But once again, it could be to adjust. No matter what approach you take for implementation, the outcome of this will be an evolving process. And what we mean by that is that exactly what it says, that it will be evolving. We'll validate the electronic workflow and processes that are put in place and validate the system performance and make changes and tweaks to improve it. We'll also evaluate the acceptance of the product and review the processes, and also we'll have to arrange for ongoing training. And the ongoing training would be more of user training, and focus the training on results and spotlight the people that have excelled with the product, and capitalize on the rising internal champions. In Formfast, I think that's our strong suit, is that we end up with lots of internal champions. So we have lots of people talking up the process and talking up the product and encouraging other people to utilize it to its fullest. The other thing that will need to be considered is the downtime and disaster recovery plan. Downtime could be either planned downtime or non-planned downtime, and we would need to make arrangements for everything to be able to be handled and for processes to continue in all of those situations. And that would be something we would actually look at beforehand as well. That wouldn't be something we would look at after the implementation, but actually look at before it. But those are also things that are going to need to be considered as well as backups and external storage and support and all the other things associated with that. Next, we're going to look at process management. The quality control process, that would consist of the things that you see there. It would consist of us doing random checks as well as your staff doing random checks to compare that what they intended was what was coming out of the system, and they would use benchmarks to compare the old process to the new process so that they can verify that they're getting the ROI that they expect to get. In addition to that, there would need to be procedures and processes put in place for software upgrades, for quality control process once a software upgrade was actually put in place. So those things, these would all be covered, as well as personnel quality control, skill and attrition process, basically being able to retrain people and make sure that people are properly trained for the product so that when people leave, that it's not a critical situation, that there's nobody left that understands the product well enough to support it. So we would make sure that all these things are done. Align retention policy with new quality controls and procedures would be sort of the same thing, except what we're referring to more there would be controlling user access and putting policies in place so that if a person leaves, that they have the ability to block that person from having access, since we're going to be dealing now with sensitive patient data. So what we're referring to there is are those abilities, the ability to control that process of people that have left, people that are coming and going, and people that need access and don't need access to the system.
Now, let's start taking some questions here because I can see some coming in. We got one from Bill. Which do you recommend, Brad, phased in or one-stop implementation plan?
We really don't recommend either. Well, the phased is a better approach, so I guess I do recommend the phased approach over the one step. But we have had success with the one step as well. So we're not saying that you have to use that approach, but it does seem to be a better approach.
Okay, we've got another one from Pam. Do I understand this correctly? Does Formfast offer consulting?
Absolutely. We actually have, and I'm personally not one of the consultants, but we actually do have consultants that would go on site and look at your current processes, look at the new processes, and redesign the process. So absolutely we do.
Okay, we got another one here from Teresa. Does Formfast offer conversion services for paper forms that we want to be electronic? Does Formfast offer conversion services for paper forms that we want to be electronic? That's the question.
Absolutely. At Formfast, we take forms and convert them to an electronic format for printing, as well as converting them to a format to be actually filled out online. So we can take them from an existing paper-based workflow into an electronic workflow without having to train them on a completely new form. So we can give them things they're familiar with as an approach to doing a workflow. So doing an electronic workflow for people may not be any different or be very little different from what they're doing today with paper, other than now the routing is all electronic and you're not actually doing it on paper. And it can actually improve things, but...
Okay, now, unless somebody enters any more questions, this is going to be our last question, Brad. It comes from Lynn. What are the time frames for these implementations?
And that varies greatly. It would depend on the level of the implementation and the scope of it. We've done implementations of single forms all the way up to an entire enterprise, and it's a wonderful thing to see an enterprise convert every form within it into Formfast, and I've personally witnessed it, and it's a wonderful thing to see the response of people when they see that you can take all their forms electronic. We've done conversions for people where we did the entire thing, and then we've done conversions where we trained them and they actually did it themselves. So we've done just about the gambit there.
Well, that's it for today then. Thank you. I want to thank you, Brad King, for being our guest today. I'm Ed Corba. For Rob Harding, Sean Curtis, John Yock, and the entire Formfast team, we want to thank all of you who joined us today. Don't forget, next seminar will be August 25th, and then September 3rd finishes up with Akron General. Take care. Bye now.
Thank you, Ed. Thanks, everyone.